Hello, everybody. My name is Valeria Caso. I'm a former president of the European Stroke Organization, and it's a great pleasure to be here and to share with you some thought about the difficult political situation that we are going through, especially from the point of view of our stroke patient. And this cannot be done only by me, but I have a co-chair, Michael Masia from the Karolinska Institute, Sweden. So I'm very lucky to be with you today. And we will share with you some of our experience from Ukraine. And especially a special guest is Francesca Romana Pezzella from San Camillo in Rome.
Yes.
And Francesca, you have to know that she thanks to her ability of networking, she created the Ukrainian task force from the European Stroke Organization. She created the need and, in a way, also the best way to continue to have some normality, even in times of war. So, please, Francesca, can you share something about your work with us?
Of course. Thank you, Valeria and Michael, for having me today here with you. And it's really my pleasure to tell you about the task force for Ukraine that is supported by the European Stroke Organization. As you know, there are different programs within the European Stroke Organizations that are networking in order to improve stroke care in Europe. One of these programs is, for example, the Stroke Action Plan for Europe. The other program is the ESOC program. And implementing this program, living this program within the ESOC community, we have been together with colleagues from Ukraine for a long time. And we have supported them, and we exchanged experiences, we have exchanged ideas, and we have somehow worked together on the improvement of stroke care in Ukraine. When the war started in February 24th, of course it was a shock. In the first days, everyone had the feeling of living a surreal situation. But we could not forget, as a European Stroke Organization community, we could not forget them, our colleagues, and stroke patients in Ukraine. So we thought, after the first shocking days, we thought to create a task force to support stroke physicians in Ukraine and to support stroke patients in Ukraine. This task force has conducted different activities. One important activity, I think, is that we have been mapping through surveys using the network and using social networks like Facebook, like the Telegram, like Google Docs. So all these internet fantastic tools that we could use to map the need of patients and the need of the stroke hospitals in the country. Before the war, there were about 200 countries accredited by the Ukrainian healthcare that were accredited to provide care for stroke patients. And of course, with the war and with the rapid evolution of facts, these activities had to be somehow suspended, reorganized, rearranged. And we were mapping how this was happening and what were the needs in terms of devices for interventional endovascular procedures, drug needs in terms of alteplase needs where the drug was lacking, anticoagulants needs for patients, and trying to help patients to receive appropriate treatment, appropriate consultations from stroke specialists. On the other hand, of course, we want to take care of our colleagues, and so we were trying to nurture their resilience and their ability to cope with such a stressing situation. And to do that, we network very often. We network very often, as I said, on Telegram channels, but also we organize regular meetings, regular weekly meetings during which we exchange ideas, but we also talk about stroke. We also talk about stroke care, about stroke trials. We talked about how we could help them, and discussing these topics, we really made I think we really made a point for them. And we are still here to support them. We're still here brainstorming and looking for ideas, looking for projects that could be done even in such a difficult and such an unexpected and absolutely unprecedented setting.
Thank you, Francesca. I forgot to say that you are also the co-chair of the European Action Plan. So when we wrote it, we did not include the variable war, which is threatening for our stroke patients. And it's an additional risk factor. It reduced the possibility to have the right care and let's say to have in all Europe the same care. This was our dream, no, for stroke,
access
and delivery for stroke care.
Absolutely. And Valeria, thank you for pointing this out, because one of the things that we are learning now is that there are no preparedness plan, no contingency plan for stroke. Stroke patients are definitely more fragile during emergencies like conflicts. They have more health needs. They need continuous care. They are probably on long-term medication, long-term treatments like rehabilitation, long-term care. They might be on palliative care as well. And all of this has somehow to be managed, even in such an unprecedented setting. And this is one of the things that we are realizing now after 2 years of pandemic, where we also were shocked by the absolutely unexpected situation where we learned how to live with the virus. This is a totally different thing, of course. It's definitely worse, but we were not ready. And with this fantastic group of colleagues in Ukraine, and with the support of fantastic colleagues within the European Stroke Organization, within the EC of the European Stroke Organization, and with your support, we are trying to do our best in order to provide the best care for patients, for stroke patients, but also to provide the best help and advice and for our colleagues taking care of them in Ukraine.
Michael, you want to introduce our colleagues from Ukraine and...
Right, so for our viewers, we asked 3 illustrious Ukrainian colleagues to record messages for us. We conducted long interviews with them, a total of about 2 hours, and selected the best material from those interviews to give you an impression of what Ukrainian stroke medicine and stroke neurology, and above all, Ukrainian patients are going through at this stage. And their words speak powerfully of their bravery and of their ability to adapt and to still care for the patients and still focus on the patients, which is the first, second, and third priority at the moment. So to begin with, we shall start with an interview with Dr. Dmitry Lebedinets. He is the head of the Stroke Center and is an associate professor of the Feofania Clinical Hospital in Kiev. So let's have a look at what he has to say.
But I want to tell you that situation is changing. Every month, every week, situation is changing. So if you go back 2 months back, so when the war started, then we had a really huge problem with understanding how to function, what to do. And it was in the whole country. So if you look to the eastern part of the country, the war was there and it's still there. In the central part, I live now in Kiev. So in Kiev, the situation was also changed 2 months ago. So some services stopped to work. But if you look to the western part of the country, then you can understand that at the beginning of the war, the services, I mean EMS services and stroke services were overloaded because some people migrated there, and also people didn't know what to do with this huge amount of people. But then 1 month after, things changed. And right now we have 2 months after the war started, and something settled down. So I can tell you what is going on right now. So if you look to the western part of the Ukraine, so what we can see that services, EMS services, EMS and acute stroke care work as normal. So people arrive to the hospital with stroke in time window for TPA treatment or endovascular treatment. These hospitals have normal amount of TPA, so they can get people can get TPA, but we have problem with endovascular devices. So then you go to the central part of the Ukraine where I work. 1 month ago, or even 2 months ago, I told you that we had a problem with EMS services because EMS services didn't want to bring patients with stroke to the hospitals because the main thing for the EMS was wound the patients and those patients who suffered from the war. But it was 1 month ago and 2 months ago. Right now in Kiev, things are getting better. So almost all the hospitals that worked before work now. So services start to work as they were before the war. So just yesterday and today we had thrombectomy in our hospital. We had thrombolysis yesterday and 1 day before. So people start so EMS start bringing patients to the hospitals as usual. If you go to the eastern part of Ukraine, there EMS services mainly work for the war medicine, and people with strokes are not brought to the hospital, so they are left at home. If you go 20 years back or even 30 years back, you remember those times when people were left at home with stroke. Other thing is very important is statistics. How many TPA treatments were done in the whole country? I can tell you about previous years. If you go to the 2018, there was 480 TPA treatments in the whole country. In 2019, 912. In 2020, 1,573. And last year it was 4,000 and almost 600. So we tripled the TPA treatments last year. So we were looking for the improvement in this year. But what we had this year, we still have TPA treatment done. We still have people treated. I can tell you that this year, in the January, we had 536 TPA treatments done. In February, 494, and in March, when the war was here, it was 341. Yes, we see that there is a decreased number, but still in the March this year, we had almost the same number as in 2018 for the whole year. So we now have still improved treatment for our patients.
What about in terms of care capacity? You
Okay,
can
so
imagine that there's an increase in demand in terms of post-surgical and so on. How are you coping there?
Okay, so I can tell you that trauma, people with trauma, people who should be treated in war medicine, they're treated in special hospitals, mainly dedicated for these military hospitals. Only if there is no capacity in military hospitals, they are moved to the normal hospitals. So that's why intensive care units in general hospitals that admit stroke patients, they still have capability to treat patients with strokes. So probably you know that we have National Health Service. Hospitals get reimbursement from the National Health Service for stroke care. And also we did several trainings, our society and with the help of our partners, Angels Initiative and BI, we created a simulation center in Poltava. And almost all the regions of Ukraine were there. So during 2 years before the COVID situation, people from all over the country went there and we trained them. Then in COVID time, we went to the hospitals and then trained people there. And we saw that people start treated patients. You know, before these times, people were afraid of TPA. Right now, physicians are not afraid of delivering TPA. So it's the standardization, is great thing. And as Valeria knows, we have a project with World Bank and Ministry of Health for stroke teams education. But the problem is that right now it's on pause. It's postponed for the next year.
Probably the pandemic in a way created already an emergency situation. So we were a little bit used to work in emergency situation.
That's a great idea. Yeah, because there were 2 years before the war started with pandemic. And of course, we got used to live in the emergency situation, as you said. I totally agree with you.
Do you work more now, do you think, than previously? Or is it roughly the same?
If we are talking about myself, I think I work a little bit more, because some physicians from our hospital, from our department, went to other part of Ukraine, especially ladies. Yeah, so all the male physicians are here. All the ladies, almost all the ladies are not here. We let them go for some period of time because they have small kids. And it's dangerous. It was dangerous here in Kiev. So that's why we let them go. That's why we worked a little bit more.
We're very grateful to Dr. Dmitry Lebedinets for giving us this candid interview. So we'll be moving right ahead forward to another part of Ukraine, somewhat closer to the front, not at the front itself, but closer. This will be Assistant Professor Pavlo Lebedinets, who is at the Neurological Department of Kharkiv Medical University.
I'm a neurologist. I'm from Kharkiv, working in Kharkiv Medical University. Nowadays, I'm living in Poltava 2 last months, but I'm still working in Kharkiv Medical University. We still teaching our students, foreigner students, but right now it's only online, so nothing changed. And I hope that maybe soon in the September, when it will be started next education year, we will continue to study them, to teach them in Kharkiv. Another idea, and we're trying to make a Telegram channel to help them to have a new documents, new guidelines, a checklist, and whatever they want. We also make a list of time when they can call to me or to my colleagues from another region if they have also some complicated patients, if they need some help and they don't understood what to do with that patient or with another one. And we have this call time by time, and I think it's also help for young physician or for a stroke department when they do not prescribe thrombolysis therapy or thrombectomy before. So it's one of the way how we're trying to communicate with our colleagues right now. The most huge problem is that patients arrive to the hospital not in time, maybe like 2 or 3 days after stroke, and we have a large ischemia and can't do anything with the patients. But if they call on time, mostly they can safely come to the hospital, and we have everything to try to help them. Unfortunately, right now, the most huge problem for us, it's neurovascular devices for thrombectomy. But with drugs, let's say everything is okay. So we have some problem, but it's not a huge disaster.
Do you see young colleagues, for example, or nursing staff being routed to
an increased capacity of trauma care or military medicine, taking care of injured soldiers and civilians.
Mhm.
Is this a fact?
Yeah, it's a fact, and really it's increasing. So nowadays, our colleagues also working. We can't say that right now we treat only patients with a stroke. So all time, if we have a lot of patients with military trauma or with something like that, we need to help, and our colleagues need our help. We also do this help, but I must say that not all Ukraine working like that. So it's mostly for east and central part. So for example, Poltava, it's nearby Kharkiv. Kharkiv, it's a front zone, and a lot of problem is there. So some problem in Poltava, also Dnipro, because in the Dnipro region, they have a hospital who treat a lot of soldiers from south fronts also. Some of them in Zaporizhia and Kyiv. So mostly west part of Ukraine, they're working like before.
What would be the main lessons learned, or unless it's too early yet for an analysis like that?
I think it can be just time for first analysis. First way, it's just you need to have very good connection, not only in your hospital, but in all of your country. And I think that you need to know what's happened in a different region, because you don't know, in that time, you don't know what's happened tomorrow, for example, and you need to know if something happened, how to help to your patients come to another hospital, and you need to have a lot of these contacts, not even in your region. Secondly, it's very important to it's important to use a checklist, because when you have a lot of patients in ambulance, in an emergency room, you can just like lose your thought, lose your mind for a couple of minutes because of a lot of people, a lot of relatives, and also you need to think about yourself too, and we also think about the period of time. So it's a shock in the first 2 weeks. So that's why for us it's very important to understand that we need to know from where we can get some information what can help us. And secondly, you need to know how to we know that the stroke for stroke we have a green zone in a hospital, so green light for everything. But in that time you need to understand that, and it's also very quickly what you need to do when you have 3 patients near CT. So it's a patient with stroke, patient with brain injury, and patient with military trauma, and you need to look and to very fast to make a decision who should be in the cities first, and not all of the time it can be a patient with a stroke. So maybe in sometimes he will be not even in a second way, but in a third way, and we need to explain to relatives why. And one of the most important, it's also communication with society, because we done some also public awareness campaign about stroke. But sometimes even in the crisis period, what we understood that we even need to push more harder. We need to explain day by day for people, for society, that stroke it's important, because for MI nothing changed, but for stroke they really think that maybe in 1 or 2 days everything will be okay. So that's why it's one of the main point what you need to do is pushing more to the society that they need to go to the ambulance. It's important thing about communication and network. I think that social media it's really helped a lot, because we done this very fast. Like in the first week of war, everything was done, and we have some documents even from the acute to early rehabilitation, just because we have some problem with rehab right now. But so that's why all of this documentary we trying to share with our colleagues. And I think that every day, even right now, like I'm checking in yesterday and right now in this Telegram channel, we have 2 new subscribers. So it means that this information, this channel, it's also spread from physician to the physician.
I was very impressed of what you said about that the war is becoming, let's say, to a lower intensity. So you are expecting probably that, let's say, the most acute, the acute moment in a way is over. like human being as we are, you adapt to this new situation?
I also think so, and I think that it's time for second way, and we waiting for that second way, because it will be time by time. It will be increasing of stress because situation, yeah, it's changed, but not so fast as we want.
Have you noticed any kind of shifts in, for example, changes in incidence of intracerebral hemorrhage?
Yeah, it's increasing, and intracerebral hemorrhage. It's increasing. I think maybe in some hospitals even twice, but I don't really sure that it's increasing in all of Ukraine. It's mostly again in a zone of war or zone nearby war. But yeah, it's true that we have a lot of intracerebral hemorrhage right now, and we have more complicated and more severe stroke. Not only hemorrhage, but ischemia too. I think it's also because of first months of a war, when patients have problem with primary prevention, and that's why we have right now the situation because of that. And right now we have like some small, like say, not trial. We're trying to make data from 3 hospitals in Ukraine. It's Poltava, Dnipro, and Kiev, and try to compare what we have right now, because all of them, they're not in a, like say, front of war, but near that, and that's why we want to see what we have right now and compare this data between all the 3 hospitals and what we have in 1 year ago, and only after that I can say that we can have a true result.
So thank you very much, Pavlo Lebedinets from Kharkiv. Really interesting to hear the details and to try and understand, try to feel the what's going on. So we move rapidly on to the third, our final interview with Dr. Marina Gulyeva. She's the executive director of the Ukrainian Anti-Stroke Association and a rehabilitation specialist physician at the Oberig Clinic in Kiev. Over to Marina.
After the first weeks of active war actions initiated by Russia against Ukraine, it became clear that the condition of caring stroke patients had changed. After surveying specialists, it became clear that the war conditions increase the severity of the stroke consequences due to delayed treatment initiation, the difficulty or even the impossibility to provide in timely and complete acute care, and consequently the demand for rehabilitation and its duration has increased, whereas its effectiveness decreased. At the same time, the availability of rehabilitation services apparently has drastically reduced due to the profiling of or disappearance of health facilities, the destruction of civilian infrastructure, the call-up of medical and rehab staff to the army, rapid migration of large groups of population. Despite the difficulties and lack of staff in most hospitals, a multidisciplinary rehabilitation has been maintained in the peaceful territories. The state provides funding for stroke patient services, including rehabilitation, through the Medical Guarantees Program of the National Health Service. As a result of changes in transport operation and frequent air raids alarms, it was difficult for staff to come to work. Delivery and discharge of patients were impeded. There were interruptions in the supply of medicine, consumable, and food. We had to adapt the schedule of work of medical and rehabilitation staff in weekly shifts. For consultation by specialists not available at the clinic, telecommunication was used extensively. For safety reasons, patients were discharged immediately after their condition stabilized. Furthermore, particularly rehabilitation was provided remotely using available telecommunication. I have to note that in the areas of active hostilities, especially in the cities of Mariupol and Kharkiv. The care for stroke patients does not stop, even under the conditions of bombing and rocket attacks. The staff heroically provides care, and the patient no less heroically accepts this care in bomb shelters or simply in the basement, where even emergency surgical intervention are carried out. Si vis pacem para bellum. If you want peace, prepare for war. It seems to us that the global stroke community should work together to develop manuals, unified standard operation procedures, protocols, handbooks for rapid introduction of stroke services in condition of war, pandemics, and possibly even Armageddon. The military action of Russia in the east of Ukraine started back in 2014, which resulted in the emergence of a large number of young disabled people, to some extent contributed to the improvement of the rehabilitation system in our country. Important legislative initiatives had been taken and reforms had been initiated in the education of specialists in physical and rehabilitation medicine, physical therapists, occupational therapists, and establishment of new rehabilitation facilities. In many cases, relatives or carers are separated from the patient. In the event of a stroke, this prevents its timely recognition and referral. Later, when caring patient with stroke or its consequences, this separate makes it difficult for them to communicate with each other and with the staff, and for decision making, and can be a reason for the delay in discharge the patient from the hospital to home. I would like so much to return to the end of February 2022 and continue to care for stroke patients without fear of shelling of air raids. We all in this world have not been prepared for the challenges of providing stroke care in the war in the 21st century. The experience of Ukraine should give a start to the research of this problem, and we will draw a conclusion all together. We believe in Ukraine, in our victory. Glory for Ukraine.
So thank you, Marina Gulaeva, for that moving interview. It's very difficult to add anything to the impression that our colleagues are giving. We're very grateful yet again. ESO will continue to support all Ukrainian efforts to support the stroke patients and stroke care. Of course, we're all longing for the end of the war and a victory for Ukraine. And ESO will stand ready to contribute to the rebuilding of Ukrainian stroke medicine where needed, and further development of their stroke science and stroke clinical medicine. Thank you, everyone, for tuning in and for joining us for this session. We've been very happy to have you here, and hope you have an excellent continuation of this Congress. Thank you.